Good morning. Just a brief introduction here. My name is Barbara Graff. I'm the marketing director at the Jolla Community Center. And we're here today with Dr. Wael Al-Delaimy, an epidemiologist who has graciously agreed to answer questions from our members about COVID-19. So welcome, Dr. Al-Delaimy, and thank you for joining us.
Thank you, Barbara, for inviting me.
Before we start, I would like to share your background so all of us can get to know you a little bit better. Dr. Al-Delaimy is a multidisciplinary epidemiologist with a medical background and interest in epidemiology of chronic diseases, tobacco, diet, and the environment. He practiced medicine in his native Iraq and Jordan from 1991 to 95 before finishing his PhD from Otago University in New Zealand in 2000. Dr. Al-Delaimy was a research fellow and research associate at Harvard School of Public Health between 2000 and 2004, a scientist with the International Agency for Research on Cancer in 2003, and a faculty member at UCSD since 2004 as an assistant, associate, and full professor. I also wanted to mention that Dr. Al-Delaimy was one of our featured speakers last year in our Distinguished Speaker Series. So I know we've got a lot of questions here that our members have sent in, but before we do, I'd like to see if you could just provide us with an update, a little summary about where we are in the county and address that curve that we've all been hearing about.
Everybody is talking about the curve. Thanks. And again, by no means what I'm saying or trying to answer is representing officially UCSD or the county. It's just my own understanding based on my background and discipline, and really trying to help the community differentiate all the misinformation to the best of my knowledge. A lot of things go out into the media before it gets scrutinized in the scientific journals and peer review. So I want to kind of just share the curve situation with one. Okay. The curve?
Yeah.
Yeah. So this is from the San Diego Union Tribune. They have this updated in a nice way, and I kind of follow it every other day. So you can see very clearly there is an increase over time. So this is starting from March, and we can see here that in general there were dips, but in general it was going up. Then I was very hopeful when we were around here. So I kind of did a YouTube brief about how things look, and I was very hopeful. And then I saw this going up. I said, well, maybe it's going to go down, but unfortunately, it kind of went up.
Wow.
And kind of still up there with dips. Now, one explanation for this could be that there is more testing. I haven't been able to find any data on the county in terms of how many tests are done per day, and if this is increasing. I know at UCSD Health Center, they have increased the screening for people beyond just patients. So
who would that screening be for then, beyond patients?
Well, they have opened it for those people with, I believe, chronic conditions, those who are doing surgery. They want to make sure that there's no contamination. So, as it's opening up now, they're beginning to do elective surgical procedures and so on and so forth that have been waiting. So all of them are going to be tested before that is done. So that could also explain. But also, I think there has been a little bit of impatience by many of the public, including here in San Diego, and with a lot of miscommunication, mixed information. People have been trying to go out, not wearing masks, and not observing this as the earlier weeks. So I believe this is related to that. Now, if we look at this next slide, again, TNN has this done nicely,
Yeah, nice.
where they have 5-day moving averages and shows the over the last 14 days by state. And we can see, there isn't a very clear, there's ups and downs, but maybe we just kind of look at California here, which is actually, here it is, yes.
Yeah.
So you can see that California is neither going down or up.
Yeah.
It's almost level, flat. While Arkansas is going down, New York is going down. It's not shown here, but I've looked at it. So, and then there are ones that are going up. Arizona and other states are going up. So the picture is still
Yeah.
now, what does that mean? It means we are not there in terms of controlling the COVID-19, so we can really open up a lot of the things that are meant to. And the most important thing I would say is we don't have the capacity to what's called do tracing and follow-up of people who might are suspected or have been in contact with a COVID case. Let's say somebody.
I'm going to stop you right there because I read about tracing. Can you describe what that is so we all know?
Yeah, so tracing is basically, let's say somebody comes to the hospital and they are diagnosed as COVID-19. What they do is they go to their family members, their roommates, whoever is in contact with them, and do testing for them, and expand on that for the duration that that person was in contact with those people, and that way they're catching as much as possible of those by doing testing. That of course requires a huge human force. I have heard estimates of for California to cover appropriately cover tracing about 40,000, about 6,000 tracers around, because we're the biggest we're the biggest state, we're 35 million. So to really have a control like what Singapore did, like what Taiwan did, like what China did, several of the other countries that were successful more or less, is that they kind of catch it before it spreads. And so we're not there in terms of testing or having the force to do that. And then I want to kind of go to the issue that a lot of people have heard. And I did provide a YouTube describing what herd immunity is, but I found this very nice video. I don't know if you are you able to see that?
Yeah, let's play it. Can Deb play it? I'm not sure if she can.
Oh no, it's okay. So I see now. I have to share. Let me share the internet. So 1 second, because I was just sharing the PowerPoint. Okay. So now, do you see this?
Yeah, it's just a blank screen. I don't see. Oh, there we go. Yep, got it.
Yeah. Okay. So if this is a kind of a video where you can see here how the spread of the disease happens. Here, when there is zero vaccination, so everybody becomes infected, and then as there is more vaccination, there is less infected. The cutoff is 75%. This is the figure here, right here. Okay, is that when we have enough vaccinated or immune, then even the blue cases, who are the infected cases, will not spread as much to everyone because it gets blocked. So I get infected, but all around me people are immune, so the disease doesn't spread. So that's
yes. Not going to happen until we get the vaccine, right? So we're talking
exactly. That's not going to happen until we get the vaccine, and or a lot of people get infected, which is not a good scenario as well, because to get all those people infected, a lot of them will die. So the vaccine is really what's been waiting, and that's not going to happen absolutely, before before the end of the year or next year. There's a German company that promised that they will have it ready by the end of the year. But again, all these are speculations. We know estimates. It's that a year and a half from the start. Yes.
Based on
Yes.
those charts, though, do you think that we're like in a second wave, or is this the same wave, or
No, it's definitely the same wave. It's the same wave. A second wave would be when we really control it, so it becomes in the single digits or very low, and then there is an exponential increase. No, this is not a second wave. And I know a lot of people said that there's potential for second wave to come in fall, and that has been always circulated just because of potential weather conditions that are, if the virus is seasonal, we don't know very well, but if it is like the flu and it's seasonal, then during the winter, it can survive longer and can spread more. And, by fall, people maybe are going back to school or something like that. So then that's where they expect there's another wave that's going to come through.
Yeah, there was a question that came up about how does it compare to the flu?
Mm-hmm.
Could you address that?
Well, it compares in terms it's a virus, so the virus spreads through droplets, and that's similar. It is not as it is more aggressive than the flu in terms of contagiousness. So it's according to certain estimates, it's 10 to 20 times more contagious than the flu. And that is just the capability of this virus to, in even small amounts that enters into the respiratory system of another person, they get a hold in and they infect that person. So the virus is not as aggressive, the flu virus. The other thing is that we know the flu or the influenza virus is seasonal. So it increases in fall and winter mostly, and then subsides in spring and summer. We don't know about the COVID. We will know, in a few months if it gets down or decreases in the summer.
That's interesting. I just wondered when you look at those charts, is there any way of being predictive about, where the curve is going to go based on where it's been? I mean,
yeah, there are modeling that can be done, and I haven't done that, and it's always a hit and miss. A model is making certain assumptions. They put that based on this spread and based on this social distancing, based on the history and so other factors, they put it in a model, and then they show this curve that says, okay, it predicts that it's going to go for another 3-4 months, and it's going to go, and then it's going to go down. So I can't say anything about San Diego, for example, but I was surprised by this uptick in the last few weeks, because I thought the social distancing, is keeping it at bay. Everybody's adhering to, we're going into that direction, and it's not impossible to do. It's definitely done. One of the few success stories around the world is New Zealand, as well as Australia, and Jordan. So these countries, totally apart, they followed very strict social distancing. In Jordan, they had fines for people. They broke the social distancing. No car was allowed to, people can only walk within the neighborhood, and only for certain purposes and so on. So they had no conditions for, no cases, new cases for about, I think, 6 days.
Wow.
And then they eased it, right? So they said, okay, now we can let people go do the shopping. Guess what? Just in one day, they had 11 new cases. And they are doing tracing, they're doing all the good things, you know, everything. So now they're going back to restriction. They're saying, no, now we're going to back. So it's a game playing with the data and with the virus, but it
Yeah.
needs two things. It needs a vision by the leadership and involvement of the public health officials in decision making. So it's not up just to the politicians or, you know, the economics of it. These are factors, but it has to have the public health, uh, and also it needs compliance and adherence by the society, education, and that's really where we had, for example, New Zealand
Mhm.
and you know, even Jordan. People are educated, they know the seriousness of this, and they comply more or less.
Yes, so, you know, the term I heard recently was data-driven policy, which I think is exactly what you're talking about. So I'm just curious about, you know, where we are right now with the phase one, and, you know, it just seems like, oh, we're allowed to walk on the beaches and we're not allowed to walk on the beaches. So I guess my question to you is, do you think we're in a good place in terms of our policy as it's matching the data with, you know, social distancing, the restrictions of businesses and beaches and so?
Yeah, you know, I'm a bit of more of the skeptical epidemiologist, or the cautious public health person. That's in many cases, one should always err on the cautious side.
Yeah.
So I am among the people who would say it's too early. The data is still not supportive of, you know, opening up, and we don't have the capacity and resources. I know businesses are hurting, people are hurting, the economy, and I know it's a very difficult decision. But at the end, you know, once we have enough confidence, and that's really, I'm following New Zealand, which is my naturalized country, so I kind of followed that, and that's what they did. They kind of adhered to it very strictly until they said, yes, now we can open it up. And they opened it up in stages and so on, and they were very, so I don't think we're there. Honestly, I don't think that we're.
So what would the data say, and how long would the data have to say that before you would have confidence?
Yeah, so as I give you this kind of example from Jordan, so they stayed about 6 days or 7
Yeah.
days with no cases, and they are people, and then they opened it up and they saw a rise in the cases, and now they're going back down. So
Yeah.
of the steering wheel, right, in a way.
Yeah. Yeah.
So in let's say here we have, you know, Jordan is a uh, poorer country than California or the US, so they might not have as much resources, but they've done better. If we go into the teens or single digits, or
Mhm.
very close, we were having 50 cases a day, 50 new cases a day. If we were going there in the 20s and less, then it becomes manageable as long as we have the apparatus and the way to be able to kind of do the steering wheel one way or the other based on the data. So that's kind of, it's a game. It's a very challenging, and that's why, as the governor said, you know, we are going following the data, and I trust what's going on at the state of California, but again, it's taken a little bit longer.
Okay. Um, Did you, I don't know if we talked about antibody tests, but could you address that? Because there's a lot of questions around that. Did you?
Yeah, so in terms of the antibodies, I know that they the area is developing. So for a fact, all the test kits are not as good as they should be. They all have some lower than needed specificity and sensitivity. What that means that they can miss cases that are positive and they put it as false negative. And that is a problem that has been shown actually by a big study recently from San Francisco, that it is nowhere close to what we wanted in terms of testing active cases. That's why a lot of the cases, I know personally somebody who had all the symptoms of COVID and went to one of our San Diego hospitals and they tested negative. But the nurse told him, treat it as if it is COVID and isolate, and so everybody knows that this is a problem. There is the other thing, which is the antibody, which when we get an infection, our body becomes immune by developing antibodies, which is different from the PCR, which is polymerase chain reaction test that test if there are bits of the virus active. So the antibody is still uncharted area, because we might have antibodies, but we're not sure if that is protective and if we constantly get reinfected. So I'll give you an example. The flu, the influenza virus, right? We get vaccinated against it every year. Why? Why isn't it that we just get vaccinated once and that's it? Because the virus has the ability to modify its serotype and the genetic type and the genotype, and then therefore kind of infects the body again, because the body has developed antibodies for a different serotype. So it's the same virus, it just evolves and changes every season. So the vaccines are developed for the influenza based on what is that year's serotype and of the influenza. We don't know about the COVID. It would be problematic if it acts like the influenza, where it changes, and there is some evidence that it does change. But if it doesn't, then that's great, because then once we have the antibodies, then we're done. And then there's this Roche companies promising that this test is going to be very good and it's going to be available, which is okay. It's better than having nothing.
Yeah, okay. All right, I am going to switch now into individual questions. I think we've answered pretty much everything, generically. I had like 5 or 6 questions from quite a few members. So I'm just going to go to individual questions now, and then we can, kind of see if we've addressed them. So from Leslie, my question has to do with the difference between coronavirus and COVID-19. The virus causes the disease, COVID-19, but if the test to identify the virus is positive, why are people counted as having COVID-19? Isn't it true that up to 25% of people with the virus exhibit no symptoms, meaning the virus has not developed into the disease? This reporting seems to overestimate the numbers of COVID-19 victims, which then causes more fear in the population.
Your voice broke out a little bit, but I got the gist of it. So the idea of knowing who gets infected has advantage of knowing, first of all, if somebody, even if they didn't develop the symptoms, is know how much is it widespread, how much is it spreading. Everybody, only 20% actually need hospitalization. So those other 80%, they might have mild symptoms. They are having what's called the carrier status, no symptoms, but they're still spreading it. So it's very important to know who they are and how much are they out there in the community, because that gives us an estimate of first, how much is the level of immunity, because presumably if they got the infection, then they are immune. And the other thing is how much it is spreading. So ignoring those is a mistake. It would not help us address it, because we're missing 80% of the cases. If we don't take them into account.
Excellent. Okay, from Kathleen, and let me know if you can hear me.
Sure.
Plan to travel and stay in hotels. Can COVID-19 be transmitted in the ventilation system if someone has the virus in the hotel that coughs?
Yeah, again, these are all areas that we don't have a very good feel and an understanding of it. I did come across one study in China that uh, managed to trace a group of people who got infected from being in the same restaurant. And
Wow.
this restaurant had no open windows, and it used, it had ventilation circulating. And they said it's unlikely that there was one person with the infection. It's unlikely that all those who got infected were were from the droplets, because there were several families and they were not all close to that person. Uh, so they made the assumption that it could be that the ventilation, which that person supposedly was near the vent where it's sucking the air, that could be circulating it around in the restaurant and got the others infected. They couldn't find the actual evidence in the ventilation system of the virus, but that doesn't mean it didn't get
Not
into
there.
the
Yeah.
air and circulated within that period. So it is potentially possible. Again, this is unknown, and
Yep.
it also probably depends on what kind of filters they have in these hotels, and is it going through filters? There are very fine filters that could more or less protect against droplets that might have the virus. Yeah, so there's a
Okay, on to the next question from Lynn. We know that most people who are exposed to the virus develop long-term antibodies and are at least protected from getting reinfected from the same virus. You might have addressed this. Why don't we know this for sure about COVID?
Yeah, I think we addressed this. So
Yep.
because
I'm going to go on.
Yep.
The virus is highly contagious, but more deadly in the older, over 65 generation. There's been some data in the news lately that suggests the MMR, measles, mumps, rubella vaccine, somehow gives people born after 1971 some protection from getting it as hard as the older set. Have you heard anything about this?
Yes, I saw there was one study. It's not, a robust intervention study. It's called, it's more correlational or observational, where they just matched the people who have taken MMR, and I believe it was among veterans in the army or something, because they get, as adults, they get MMR. So that's one of the studies I came across. And they found that most of them didn't need hospitalization. Now, could be that they're mostly because they're younger, that's why they're in the army, or I forgot the age group actually of the study, but it was overlapping and it's suggestive. Now, could it be? Yes. Why? We don't know. Potentially the immune system is kind of upregulated, so it has a stronger presence in terms in the face of a virus. Again,
Interesting question. Okay, I just had a question myself here about just going over the drug treatments that are being presented today. I know the HIV and antivirals were, being considered. Just wanted to have you comment on drug treatments.
Yeah, so far there isn't anything really solid, and the best situation, I think also it's a study from China, the anti-HIV antiviral drug was able to decrease hospitalization by 30%. So that's basically what it did. And so I think it was, instead of 11 days, it was 8 days or something like that. But it doesn't, it doesn't cure it. It doesn't prevent it. It does help. And therefore, the FDA has given kind of an exceptional authorization for the use of this in hospitals for hospitalized people. And
what exactly is the drug doing in terms of what symptoms is it preventing? Do we know what it's doing, like from the lung area or anything?
I'm not aware if
Okay.
it is, and maybe there's something, but again, these are all we are we are not there. I mean, many of the situations, we don't know the mechanisms, but there's a study and it works, and the FDA is not going to go into the lengthy of, okay, try this and try this, because it's an emergency situation. So they just said, since it's already approved, safety is okay with the dosage, then give it to those, even if it's just decreasing hospitalization or severity.
Okay. Okay. A question from Carol. How long and how many times can a paper mask be worn by the same non-infected person? Good question, I think.
Yeah. You know, I have a mask that I've been using. I don't go out except, you know, every 10 days or so to do shopping. I've used the same mask. It should be okay to use it, and unless, you know, it gets soil damaged or water falls on it or something like that, it's fine. It's you know, the only thing is you don't want to have the mask after you come back, or you have it lying around in the kitchen or somewhere. You know, put it somewhere in a box or somewhere in a cupboard, and, you know, wash your hands just in case it has the virus on it. The real benefit of the mask, especially these not the N95s, which are the ones that could filter out viruses. These general masks is to prevent us, if we have the infection, from transmitting it to others, as well as it limits the amount of droplets. If somebody is, you know, sneezing or there are droplets somewhere, it limits how much we breathe in the larger droplets. The small droplets will still go in. So, so as such, I think it's totally okay to reuse it multiple times.
Okay. Okay, from Skip and Ruth, I have heard that they can check on the virus to see if it's growing or shrinking by testing the sewage system, and they can tell whether the virus is in a particular town. Some towns do not have any sign of the virus, but after analyzing the sewer system, they know the virus is there. Other towns have high density of the virus. Could it also be in the water filtration system?
Yeah, I found there's a study by the WHO, World Health Organization, that affirmed that even though a virus can be found in the sewage, it's unlikely to be infective. It's vulnerable to water, unlike other types of viruses, the arbovirus and other viruses that can survive in the water and get transmitted. So that is one thing. The other thing is, we don't know. I mean, if this is a good measure of the presence of the virus. You know, the bottom line, it is unlikely to survive in water, and the chlorine that is in the water is enough to destroy it, as according to this WHO report. The World Health.
That may say something about swimming for me. I don't know.
Right?
That may say something about swimming in swimming pools.
Yeah, I think based on that, swimming pools should be safe.
Okay, that's the best news you've given me today. Okay, I had another question. Of all the people that are asymptomatic, what age group do they fall into? So there's a lot out right now. I just read a report from CDC that says that the 20 to 54 age category are making up 38% of the hospitalizations, surprised me, with 20% among 22 to 44-year-olds. Why do you think this is so?
Well, it's as we are having more and more cases, the shape and the demographics is getting us, you know, better understanding of the severity of this, that really not everyone is immune. Yes, the likelihood of those who are older is much higher than the younger folks, and that's simply because the immune system becomes slow, becomes less active with aging, and so they are more vulnerable. But clearly, it's as you saw the numbers here, that no one is immune from hospitalization and the severity of it. You know, I had a far relative in another state where she believes she contacted that. She's young, in her 30s, and the family, all the family got affected. It was very severe. They suffered for weeks, and they're young and healthy. They have no other problems, and everybody who has experienced it is saying it's a terrible, very severe disease. So I am not surprised by these numbers at all.
Yeah. And, in that same study, of course, talking about children being a source of transmission, there's just a lot out right now that, to just be careful, thinking that they can't,
No, absolutely. There's again, it's a new disease, so we're discovering. I mean, I came across some news that it's affecting their cognition or brain or neurology, and so a lot of things out there we don't know about.
From Deborah, who's helping us host today's meeting, is there any information on COVID-19 cases decreasing during warmer months, affected by high temperatures and humidity? And also she mentioned, any other environmental issues, climate change or whatever.
Yes, so very good question. First of all, we know air pollution is a terrible situation that exacerbate the infection and the ability to infect the lungs, because it's already compromised by high air pollution. So that's one definite factor. In terms of the weather, clearly, the colder the weather, the more it can survive. And so in terms of humidity, there's mixed feelings about it. So some believe that with high humidity, it can survive more. Others, like the flu, it survives in dry, cold weather better than higher humid. So we don't know how this is going to behave. We will know probably in a couple of months when the summer season comes how that is. Now, that being said, I don't believe it will just kind of disappear even if it becomes very warm, because where we're going is mostly air conditioned and it has the ability to survive on objects as well, which is something that has been shown.
Okay, I think these questions from Fran were probably addressed, but just to honor her, she just said, phase 1 in California's safety and preparedness, why wasn't the state preparing for safely opening businesses prior to May 1st? I think you answered why we need several more weeks, but in terms of states preparing for this, I don't know whether you can address that or not. It's kind of a...
I think the state was not prepared to open it up, and because we're not there. As I showed you the figures, we're not in a steep decline, and we're going there. And the reason, my own personal opinion, I don't know, the reason it's opening up because of the pressure that they're having from people and the economy and all that. So I think that's why we didn't see that they were very well prepared, organized for the phase 2.
So, do you believe then that they should not be opening, like she's saying, well, can't we open like a bookstore and only allow one person in or something like that? In your opinion, based on where we are now, you still don't think that's a good idea, correct?
I don't think it is a good idea, because for the simple reason that I mentioned, we don't have the preparation to tackle this if it goes out of hand, if it spreads more. We don't have the testing capacity, we don't have tracers, we don't have, yes, what was suggested would make perfect sense if we have it where we are in New Zealand now. We have no cases or very small cases. We have a team of people. China, how did they control it in Wuhan? They mobilized thousands of public health tracers and from all over the country to go to there and target it. That's not happening yet.
What would be our first step in that regard then? To set up a team,
Yeah, absolutely. That is a priority. I mean, there should
at a basic, even before the tracing aspect, what would the team do?
The team would be trained on how to ask the questions, how to protect themselves, how to trace the people, and what are the advice and suggestions, who to quarantine at home, who to ask to be referred to hospital, all these kind of things, and decontamination, So it needs a lot of resource and capacity to build up so that they can be mobilized and go immediately. Not say, this case came today, and yeah, we'll wait 3 days before we go to their family. No, because by that time, if there are infected people, they've already gone further. So that's the idea.
In New Zealand, did that come out of the public health? Is that where that came? Yeah.
Yeah. So actually, one of my colleagues, and he's the public health kind of. They have a position there, like the highest public official, and I believe it's like the Surgeon General here. So he was the person who was talking to the media, and sometimes the Prime Minister beside him, just kind of support. But he was calling the shots, or not just calling the shots, providing the evidence to the population, answering and advising the government. And he's now considered a celebrity and a hero for helping navigate this challenging situation in the country. So so that's where this nation, our nation, and the state should be acting like. I think the governor of California is doing really good job, in my opinion, from that perspective.
But perhaps maybe as you're talking, I'm thinking about the county of San Diego, public health in San Diego could, perhaps, and we don't know their resource situation. I'm just,
yes,
about that. Where would the team get developed?
I read on their website that they are listing, they've trained another, I think, 100 or so, 30 people as preparing for addressing the spread. And again, I think the capacity is not there yet, definitely.
Yeah. Okay, I had a couple questions from Jerry and Portia. What can we do to improve immunity against the virus until a vaccine becomes available? Jerry says, assume age is a risk factor, over 65, but otherwise he's in good health, no disease. What supplements or vitamins, etc., would you recommend?
Yeah, that's a very common question, and a lot of people are thinking about it. And the fact of the matter, we don't know exactly what are the dietary nutrients that are going to boost immunity. A lot of people have made businesses out of claiming this and that, and as far as we know, minerals, trace minerals, elements, and vitamins are really essential in terms of making the immunity efficient. So I would say taking multivitamins would be very important. I do that, and that covers any deficiencies. The other aspects, like getting exposed to the sun for vitamin D, there's no harm in that, absolutely. Does it help immunity? We don't know. Some of the things that are, used, herbs and others, they all probably are okay. Antioxidants, are they guaranteed to increase the immunity? We don't know really, for sure. One of the things I like is the black cumin. Take it a little bit. It has been shown numerous studies. It's very powerful antioxidant and can boost immunity. But that doesn't mean, that's it. And
Did you say? I'm aware of cumin. Did you say black cumin? Is that what you said?
It's called, yeah, black cumin. Yeah.
Oh, interesting. Yeah. Okay, very good.
Yeah.
And then Portia.
Yes, go ahead.
Oh, go ahead.
No, I mean it has to be taken in very small amounts, like half of a small teaspoon per day, not more. And sometimes it comes like the black pepper beads almost, or crushed, or sometimes oil. But anyways, I'm just saying this is just an example. But the best thing is take multivitamins, fresh fruits and vegetables, and also be physically active, because physical activity is always good to the immunity. Absolutely. Not to reach to, very stressful, but being physically active is definitely helpful. And the things that do undermine immunity is stress. So stress, even the mental well-being can undermine immunity, among others. So as you know, as somebody who's healthy, just maintain a good healthy style, diet, being physically active, a lot of fruits and vegetables of the healthy food, and take multivitamins. That should be the best combination.
Okay. You kind of addressed this a little bit, but we didn't talk about the number of pandemics in the last 30 years. This is right into your sweet spot, I think. So based on, your understanding of Zika and MERS and so forth, what is your prediction for future pandemics based on this history?
Yeah, that's an excellent question. Actually, it's related to the what's called zoonosis. So zoonosis is the spread of infectious agents from animals to humans. And that has been happening much more frequently than previously. So the HIV is believed to come through the monkeys, and the MERS, which is the Middle East research syncytial virus, which is a part of corona. It's of the family of the corona. It's one strain of it, was spread by camels,
Wow.
and the SARS and the HN1 through pigs, swine, and so you can see all these animals are spreading this. So the question is why? That's a very, very excellent question. That is needs probably whole description of the factors. It's a combination. Part of it is our kind of invasion of a lot of these areas where animals are, like, in the case of Africa or in case of China. Part of it is that people are spreading around very fast. So, we might have had these diseases, but now with airlines and cheap travel, and which is, now undermined, of course, people travel a lot and spread, and that causes a pandemic rather than it might be contained or goes. Other explanations related to the sustainability, the built environment, the climate change as well as part of it. All these are aspects that are making us getting more and more exposed, and the understanding is these viruses do spread, but then they die out. They do spread and they out. But then when it's going on and on and on intensively, then a breakthrough comes, and then they get a foothold in the human. And once that is there and it gets transmitted from one human to the other, then that's when. And that's one of the explanations for the swine flu, where it was believed that it was always there with the swine and the pigs, but because of intensive raising of swine in very unhealthy conditions, and the virus gets circulated and intensified, and then people are getting exposed to it, and then that's how it crossed into the humans. Now for this latest one, again, it's believed some kind of bush meat related animal that is rare, that was consumed as one of the potential sources of it.
So it's, based on looking at that history, I mean, it looks like we're headed for more pandemics, correct?
Absolutely. I think everybody has that understanding that we're going to get of this, yes.
Yeah. A question that I had too, just someone I was talking to is saying, oh, well, people in New York, they're clustered living conditions, so there's more opportunity to spread the virus. So in other words, we don't have to worry as much, but I'm not hearing that from you. So address that clustered living conditions question.
Yeah. It's all relative. I mean, it's all relative. Yes, when overcrowding happens, absolutely. Yeah, it goes more and fast, but that doesn't mean we're immune. Otherwise, we wouldn't have the cases, right?
Right, exactly. You mentioned the life of virus on surfaces. I don't know, I just maybe wanted to address like just a very basic, we're getting packages delivered, or, something that we need to understand about maybe some types of cardboard or plastic surfaces and the virus.
Yeah, so there was a couple of studies. One of them was actually published on the WHO, World Health Organization site, where it did try and address how long each virus can stay on a surface. And it ranged from few hours to few days. The worst, I mean, when I say worst, that it could stay longer, up to 5 days, was glass, plastic, steel. These seem the virus can survive longer. Again, this is very interesting that the virus can survive that long based on these studies. The cardboard and other, they estimated up to 2 days, more or less.
So,
So
you're getting a package in the mail from the.
yeah, so what I do, I mean, again, I wear my gloves and I take it to the garage. I open it carefully and then take out the material. And if I can wash the material, then that's fine. If not, what I do, I just leave it out in the garage for a couple of days. Throw the package, but the whatever is inside, also leave it out before I use it. So that's a precaution. Maybe it's not a high risk. I mean, that has been shown. It's not a high risk. It's very low risk, but if you want to be one on the safe, it's not a difficult thing to do.
Well, and same thing with food safety. I mean, there's been a lot of videos online about it and how to wash your vegetables, but maybe there's just some basic comments on if you're purchasing vegetables like, cucumbers or, whatever you're purchasing in the food store, what would be kind of some basic tips on food cleaning?
Yeah, again, there are a lot of things that have been mentioned about this, and as long as one doesn't overdo it, anything one can do is washing it with a little bit of soap and water, anything that will release if there is a virus, or not just virus, other bacteria that could be on that surface. A solution of vinegar and water is okay. If it doesn't damage, it depends, like herbs and others might be more. So as long as one just does the proper washing, it should be okay.
Okay, so I'm complete with our questions at this point. I always like to ask if there's some kind of hopeful message for us, because there's a lot of fear and, we want to really, be proactive and have some hope.
Yes. Yeah, I think, as long as one is doing the things that they do and being cautious about it, not indulging, not going and, in crowded places and having, parties or going into things where it is very high risk, because there are some people, young people are doing that, just almost defiance or say, I don't care. That is not appropriate. Anything else that is being done, that's fine. It's not like it's hitting people like the plague where everybody is dying left and right. No, people can go and function normally, and eventually the key that will turn this is, in the short term, is testing and tracing. If that happens, then we're good. And that's not too difficult. I mean, the test kits could be made available and widely spread, and that could, then the ultimate, of course, is getting the vaccine. So it's a matter of patience. Like, if we can just weather through this period and consider the new norm, honestly, I was just advising others today in an email who was saying, they're in the home, they're, teaching their kids, and I said, look, we have to mentally, including myself, say this is the social norm, the new norm. Masks, you have to wear it for the time being. Don't leave the mask, and just be careful. Wash your hand. Don't go out places unless it's necessary, or to have a walk, or places where you can have your distance between people open up in the open air. All these factors, we can function. Of course, the problem, of course, doesn't solve the businesses that involve close contact. These are going to be a challenge that, again, if we have the tracing, if we have the testing, we could still do.
I'm just going to ask a quick question about, I'm going to go back to the testing kits. What was your last understanding of timing on those in the state? Do you know?
I have no idea,
Yeah,
honestly.
so I was having trouble finding some of that data myself, so.
Yeah, I
Just-
have no idea. And again, unfortunately, that's one of the drawbacks here in the US. It's a large country with a lot of states and a lot of jurisdictions, federal, state, and so on.
Mhm.
And there is, unfortunately, not clear leadership and transparency about these at the federal level that is trickling to the state, unlike other smaller countries where they can do that, like
Right,
5
right.
million people in Jordan or 6 or 7 in New Zealand and so on. Although Australia is more than 20 million, they managed it. They're now opening up. So it's not far-fetched. It just needs a little bit more coordination and like we both don't know what's the situation of the kids. That's a problem.
Right.
We should to a certain level know by this we're going to have enough kids.
Exactly, a plan.
Yeah.
Well, I just want to say on behalf of the Lloyd Community Center, thank you so much. We have to be in our new norm, but can't be positive and connect with friends and family and find.
Yeah, and the positive thing. Look, we have the technology. We can do a lot of this without this technology. Think about it. We would be in a much more negative situation thanks to the internet.
Yeah, well, we appreciate that, and our members appreciate the answers to the questions. So thanks again, and have a.
Thank you.